today's CME. Before we begin, allow me to provide a bit of housekeeping. I will now disclose the ethics or rules and regulations for today's program. First, participants are required to log in using your full name as registered. Link will be provided later. Second, to prevent any unwanted background noises that can distract other participants, please do ensure mute your microphones when you are not speaking. Third, if you have any inquiries, you may address it by using the chat box. Fourth, the organizer will record the program session for future references. Please comply to these ethics and regulations throughout the program. We appreciate your attention and cooperation. Ladies and gentlemen, I would like to extend a warm welcome to our today's speakers and fellow participants. The objective of having this program is to give exposure for the Sultan Ahmad Shah Medical Center at IIUM staff about the personal protective equipment, PPE protocol, and COVID-19 awareness at the workplace. Before we start the session, please allow me to brief a little on the background of our three speakers for this morning. Our first speaker is Assistant Prof. Dr. Muhammad Abdul Shakur bin Abu Hassan. He is Head of Department, Emergency and Trauma, SASMEC at IIUM. Next, Assistant Prof. Dr. Nur Hidayah binti Kamaruddin, our Clinical Coordinator, Infection and Prevention Control Unit, SASMEC at IIUM. And lastly, Brother Zulfikri bin Abdul Hamid, Pharmacist at Department of Pharmacy, SASMEC at IIUM. With that being said, this would mean that it is time to begin listening and learning from speakers today. Without further ado, I will pass the session to our first speakers today, Dr. Abdul Shakur.
Assalamualaikum warahmatullahi wabarakatuh. Okay, can you all hear me?
Can.
Right. So, okay, Assalamualaikum warahmatullahi wabarakatuh. I'm Dr. Shakur, so the head of GC department, as mentioned by the moderator just now. Thank you for the kind welcome. So, I'm also the head of the emergency disaster and crisis center at the moment. So, as mentioned, I'm going to brief all of you regarding the update of our COVID-19 guidelines in hospital SASMEC at IIUM. So before that, I would like to congratulate all of you, okay, all of the staff hospital, because we have been through this for almost 2 years now, and I know all of us have been enduring this hardship together, and now we are seeing the light at the end of the tunnel. Hopefully, inshallah, we see a lot of improvement in the situation globally and also in the country. And I would like to congratulate all of you because all of us have been in this together. We've been standby for the patient. We've been putting ourselves at risk and our family member at risk with the COVID-19. And we become what they call now is a frontliner. And we also participate a lot in providing the vaccination to all our population. And Alhamdulillah, we already reached more than 90% adult population vaccination status. And I know all of you are happy at the moment because last Monday, we are already announced that we can cross the border, we can cross the states. So maybe some of you not in Kuantan at this moment. So I would like to congratulate all of us for that. And inshallah, may Allah grant us Jannah for whatever we have given for the past almost 2 years. And inshallah, it will be one of our greatest deeds to be counted in Akhirat, inshallah. So for now, I would like to continue with the update. Okay, I'm going to share my screen. Okay, can moderator confirm me whether you can see my screen or not? Or can someone confirm me that they can see my screen?
Yes, Dr. Shakur, we can see. Yep.
Okay. So As we all already in the COVID-19 for almost 2 years now, I think most of us already aware that in our website SASMED at sasmedium.edu.my, there is a COVID-19 guideline in the website where you can access and look into it. Correct. This is the second edition, but today I'm going to share about our latest edition, which is the third edition. Okay. So which we will update in the website also later on, inshallah. So, and then without further ado, I'm just going to show you, this is going to be our third edition, all right, of our COVID-19 guideline. Okay. So there's a lot of content here, and it's most of it is just guideline and also flow charts. Okay. But today I'm just going to briefly discuss about, I'm just going to refresh all of you what is emergency disaster and crisis center and what is their role. And then I'm going to share about rapid assessment team. I'm sure all of you already know about rapid assessment team, but I'm just going to brief you again. And then we're going to look at the guidelines, mainly for the patient entry to our hospital. Okay. I'm going to go through with the screening of patient at the entrance, and then going through the emergency department guidelines, admission guidelines, okay, referral protocol, maternity and neonatal guidelines, and also forensic department guidelines. Okay, and then we're going for a short, quick Q&A session. So without further ado, I'm going to show you emergency disaster and crisis center team. So as you all know, I'm one of the team. I'm the head of the emergency disaster and crisis center, and we have assistant professor Dr. One Ppe. I'm sure you all know she is currently our main physician for COVID-19 in the hospital, and we also have assistant prof Dr. Nur Hidayah Kamuddin, which is our head of microbiologist department. So she also played a significant role in our testing and our PCR test, RT test. And then this is my MOs, Dr. Nur Fahana Binti Bacho, Dr. Nur Amira Binti Saidin, and also our nurse Nur Asmida Binti Ibrahim, which I think most of you already recognize them because they are the one who answer the call and attend to all your questions and your queries throughout these few months, right? Okay, so what is our role is actually basically we are holding the SOP, so everybody who have questions regarding the SOPs going to you can ask us, and we also do contact tracing. We coordinate the contact tracing if there is a patient positive in the hospital or even the staff positive in the hospital. And we also organize, coordinate the swab test inside the hospital and outside hospital for our staff. As you all know, we have swab booth, and we also collaborate our we also share our information together with PKD. Oh, sorry. I'm just going to enlarge the screen a bit. Okay. All right. So we are going. We also share our information with the PKD. Okay, because they are going to monitor our patient or our family member outside hospital. Okay, if there is a contact from the community, right? Okay, that's mainly our role, and together with the hospital, we have a meeting every Monday and Friday together with the all head of department and hospital director, okay, deputy director, all top management of the hospital. We will be discussing regarding the latest COVID situation in the hospital, and we also will be decide on the latest guideline and the latest SOP throughout the years, okay, and we update every single time there is a new updates and a new improvement of the situation or changes of the situation globally and also in our country. Okay, so and then we have rapid assessment team, okay, which is consists of specialists, medical officers, sisters, and staff nurse from all the department. Okay, we also involve paramedic staff also in the red team, what we call red team, and their job, they are there to help us. Okay, to help us to one, identify potential case based on the information received from the ward staff. Okay, they help us in conducting the contact tracing of healthcare workers, patient, and also any others who may be exposed, for example, caretaker or visitors. And then they also help us in gather relevant information required by the rapid response team. Okay, and also they're going to notify us, right, the ADCC, of the situation of any hazards or weakness identified in the ward. Okay, so they are actually one of our main important forces to help us during the contact tracing. Okay, all right. Okay, so these are the list of representatives for the rapid assessment team. As you can see, we have a lot of names here. Consist from almost all departments. All right. Okay, so without further ado, I'm just going to update you. Okay, we have these changes mainly because most of us now are already vaccinated, and there are a lot. There are going to be a lot of interstate travel. Okay, so previously we have a restriction on interstate travel, but now the government already opened the borders, so we are expecting increasing numbers of patients to come to a hospital, especially from inside and also outside Pahang. Right. So I'm sure all of you aware about this declaration form. Okay, basically this is how we guide, monitor our visitors or our patient to come to the hospital. All right. So basically there are five. Previously there are 4 questions, but now we include another 1 question. Basically, we want to ask whether they have a close contact with someone is positive or not. Okay, and we define what is close contact here. Okay, and then we ask whether they are in a PKPD or MCO area within the past 14 days. Okay, and if they answer yes, they have to answer the question number 5, and then we want to know whether they have been treated as COVID-19 and when was the last day of their treatment, and then we want to know whether they have symptoms or not. Right. Okay. By now, I'm sure most of us, I think all of us, should know what are the symptoms of COVID-19. Right. And then if they answer they are from PKPD area or MCO area, they need to ask question number 5, which is whether they are vaccinated or not, and then whether they are complete vaccination, which defined as 14 days for 14 days post the second dose for Pfizer, AstraZeneca, and Sinovac, and also 28 days after the first dose for CanSino and Johnson & Johnson. Okay. All right. So screening patient. Okay, screening patient at the entrance. So as you all know, we have screening nurse during this COVID-19. All right, where they help us in monitoring all the staff, all the staff, or the students, the patient, the family members who going into the hospital. Okay, they are our main role in protecting our gate actually. Okay, so we should congratulate them because they have been enduring a lot of hardship for the past 1.5, almost 2 years now. They have been, some of them have been screamed at by the visitors, some of them have been cursed at. Okay, but they are very dedicated in making sure that we are providing the safe area for our patient, our visitors, and our staff in this hospital. So I would like to thank to all of them, and I hope they can continue to be as dedicated as they are. All right. Okay. So at the entry points, reflecting to the question just now in the declaration form, so we will see whether they have symptom or not. Okay. If they have symptom, we are going to direct them either to the nearest clinic kesihatan, or we are going to direct them to the family health clinic, IUN. All right. If there is no symptom, then we're going to see whether they have close contact with the confirmed COVID-19. If yes, we cannot allow them to enter. We inform patient to go home and to contact PKD for further instruction. Okay, because if they have contact, they are close contact number 1, right? So they should be under quarantine, right? So and then the screening nurse will also ask them to call the clinic and reschedule their appointment. Okay, and then if require medication, the screening nurse or the MO at the screening counter will help by calling the respective clinic to renew prescription if needed. Okay, so screening nurses, I hope you all can ask this and ensure that our patient receive their medication even their appointment have been rescheduled. Okay, and then they are going to collect the medication through the drive-through. Okay, and then if they are from NCO area or PKPD area, as we mentioned just now, they need to tell us whether they are fully vaccinated or not. Okay, if they are fully vaccinated, then we don't have any issue. We're going to allow them to enter, okay, our hospital, to go for the appointment, to go to visit our hospital and all. But if they are not fully vaccinated yet, as per defined just now, we are going to see whether there is urgency or not to come to the hospital. If there is urgency, okay, they cannot be rescheduled. They have to be there that day. Then they have to inform the screening nurse will inform EDCC, and then we're going to take RTK swab test in the swab booth. And then when the result is out, if negative, then we allow enter. If there is no urgency and they can reschedule the TCA, then we ask them to reschedule the appointment. Okay, and most of the MCO area or PKPD area, they only usually quarantine for about 14 days. So it shouldn't be long. Okay, the next TCA. Okay, and then if they have history of being treated as COVID-19 patient, so we want to know their confirmed date and positive, when was their positive PCR test and the date of the discharge, and then the nurses will call us to inform whether they are allowed to clear to enter or not. Okay, because in some states they take 14 days quarantine, like Pahang, but in some states like Selangor they only take 10 days. All right, so different state with different quarantine days, number of quarantine days. So that's why we need to ask this first, right? And then if they answer no to all, of course we allow them to enter. Okay. Okay, this is the general guideline, so I'm not going to share this. You all will be able to read them when this guideline is available. Okay. So I'm going to straight for emergency and trauma department admission. Okay, so in emergency department, the patient will the patient who presented with ELI, okay, influenza-like illness, fever, runny nose, sore throat, or SARI, okay, severe acute respiratory illness. So if they have short breath, chest pain, okay, rapid breathing, poor oxygen, right, and they are high risk. Okay, high risk meaning that they are close contact or from KPD area. We're going to see whether this patient is stable or not. If stable, we are going to treat them in the fever counter. If they are not stable, we're going to admit to our SARI zone. Okay, and then we're going to treat them with SARS and stabilize, and then we do RTK test. If positive, they are going to be see whether they require for admission or not. If required admission, they will be admitted to the proper COVID ward, and they are going to be taken. They're going to be test for PCR, and if they are negative, we are going to treat accordingly to the normal public. Okay. So from emission, from emergency to ward. So if patient plan for emission, if RTK negative, we're going to emit as normal. If positive, our team in emergency department will inform DCC, and then we are going to be emitted to proper COVID ward via the COVID pathway. Right? I'm sure all of you know the pathway now. Okay. So this is just some management for difference management of Cat 1, Cat 2. I'm not going to share this. We're going straight to the admission protocol. Okay. Okay, this is the admission protocol. Okay, so because we have a lot of patients coming, can be admitted from clinic, can be admitted from emergency department, can be elective admission. So these are the admission protocol. So for urgent admission from clinic, for example, after a patient reviewed in clinic, then the physician or the surgeon decided that they require urgent admission. All right. So they need to call emergency EDCC, okay, and then the clinic staff will direct the patient to the swab booth that we have and to take RTK, okay. Then based on the RTK result, if positive, we're going to inform the PKD. If not urgent and patient in Cat 1 and 2, we're going to reschedule the admission. If urgent admission or patient is Cat 3 and above, we are going to admit to the proper COVID ward. Okay. If indeterminate, then we're going to see whether we need to admit first. Okay. If no urgent admission, we're going to notify PKD for retest. Okay. And then if negative, of course, they're going to admit as per normal. Again, the next one is elective admission. Just now is urgent. Elective admission. Okay. For now we don't previously we don't have issue for we don't have issue for any elective admission from for any patient. However, we only have a flow chart for the MCO area or PKPD area. Okay, so patient from PKPD area or MCO area, okay, because they're going to be supposedly they're quarantined for 14 days in their neighborhood. However, if there is required for elective admission, we're going to see whether the primary team need to inform us, decide whether it is urgent to admit or not. Okay, if it's urgent, we're going to inform the EDCC, and then we're going to take PCR, okay, at the respective area. Okay, we did at the respective area. If positive, then we will send this patient to the regional healthcare facility or the nearby kesihatan. Or if negative, then they can inform EDCC and they will allow admission. Okay. Reason we use here to be taken RT-PCR at respective area because as you all know, PKPD area is not just in Pahang. They are also elsewhere in other states. So it's difficult for them to just come here, do PCR and wait for almost 2 days, and then if positive, they have to go to the nearby in clinic kesihatan. So we want them to do at their own place. So if positive, they can just quarantine at their own area. Okay. And then we have a flow chart for elective procedure. Okay. So for elective procedure, so of course from clinic, if they set for date for operation, and then we will see whether it's a major or not major. So when they already set, they need to submit the names of all patients who are planned for operation, and they're going to give this detail: name, RN number, IC, phone number, and procedure date and admission dates. This is from the team or the clinic, okay, to give the EDCC the information, and then we going to arrange for testing. Okay, so basically we're going to take RTK 48 hours prior to admission date. Okay, and then if they are negative, then we allow to enter as to be admitted as per normal. Then if positive, we're going to inform KD, and maybe they need to reschedule because this is elective procedure. All right. Okay, and nowadays, previously we don't allow caretakers, but now we start to allow caretakers and visitor in the general ward. So what we are going to do is that for caretaker, we will see whether the caretaker is from PKPD area or not. If caretaker is not from PKPD area, okay, we are going to go with this flow. And if from PKPD area, we want them to do PCR first, okay, at their own area. Again, the same reason as earlier. So if it's negative, then we allow entry. Okay. If they are not from PKPD area, they are from anywhere else. They're from Selangor, they're from Perak, from anywhere else. So they just need to go to the screening counter nurse at lobby level 2, okay, from 8 a.m. to 5 p.m. every day, okay, every day, including Saturday and Sunday, 8 a.m. to 5 p.m. And then they're going to perform saliva RTK test in front of the screening counter nurse. Okay, we have a dedicated area where we provide a table, we provide the hand rub, and then they can perform with the poster how to do the saliva test, and then they're going to do the test, monitored by the nurse, of course, with a safe distance. Okay, and then they're going to show the result. So if negative, we're going to allow the entry. The nurse will give them a form so that they can be confirmed that they are negative by the ward staff. Okay, and then if, however, if positive, of course, they're going to need to inform EDCC, and the caretaker will not be allowed entry. And if the caretaker will be directed to PKD, okay, for further follow-up. And then the patient, okay, the patient that they want to take care of, if there is a close contact, okay, then the patient will be treated as PUI. Okay, that's why they, if positive, the staff screening nurse at level 2 lobby need to inform EDCC. Okay. Okay, this is regarding vendor. I think I'm just going to share a bit, right? So that you're all aware. Sometimes you're going to see vendor at your ward or at your OT or your clinic, so you need to know whether they are already done or not. Okay, so for vendor, so we have the divide the areas into non-clinical areas and also clinical areas. So for non-clinical areas, we are going to allow entry. Okay. Okay, we don't need any further details. But in clinical areas, we're going to perform RTK saliva again at the level 2. Okay, if positive, same flow. Okay, if negative, we allow entry. So the vendor will also go to the level 2 nurse, level 2 lobby. All right. If the vendor is from MCO area, of course, you need to reschedule the visit. Okay, wait for the MCO lifted. All right, and then we're going to the referral protocol. All right. Hold on, eh? Okay, so for referral protocol, okay, we make it simple. We have only 3. Okay, number 1 is that from IMSC. Okay, IMSC, our private wing of the hospital specialty center. Okay, so for this IMSC, we are going to consider them as a part of like a extension of suspect. So basically, okay, they're going to do tests over there. Okay, if the test never done in IMSC, so IMSC need to do RTK, and when the result is up, then they can transfer. If negative, they can transfer. Okay. If it's already done, so we accept the RTK and PCR within the same emission. For example, if they are emitted already 5 days in IMC, okay, and they have done during the emission, they have done RTK or PCR, and it was negative, and throughout the emission, they don't develop any symptoms, COVID-like symptoms. So we will be accepting the test result, and they can enter SUSMED without any any test required. Okay, and then if they are discharged from the date of their discharge, okay, from the date of their discharge, we will still accept them about 48 hours from the date of discharge, and we don't need to repeat the test. Right? For example, let's say they discharge today, okay, at 12 p.m. Okay, so 48 hours, within 48 hours from 12 p.m. they come to SUSMED, okay, within these 48 hours, we don't need to repeat RTK if it's already negative. Right? We just need to confirm, if they say they just discharged from IMC, we just need to confirm by calling IMC and see whether what's their result are. Okay, what their result was. And then we allow to enter SUSMED, and then if they presented to ED, if patient stable, they're going to straight away register at the registration counter, and then we're going to inform ward, and also ambulance will bring the patient to the basement and enter to ward. Right? If patient is not stable, of course they're going to stabilize in emergency department. Okay, do we need to stop for the doa? I think let's stop for a while for the doa. Okay, Amin ya Rabbal Alamin.
Excuse me, doctor.
Yes.
10 minutes left before Q&A session.
Okay, almost
Alright.
finished. All right, so and then this is from external hospital. Okay, from external hospital. Simple. Basically, we want them to have PCR. Okay, so if they have PCR, we accept them within 48 hours from the time to transfer. Okay, so if they are negative, we allow transfer. Okay, again, similar. If patient not stable, if the patient going to be stabilized in emergency department. If stable, they are going to be registered and straight away into the ward. And if patient was not done, we're going to ask them for PCR, okay, and then wait for the PCR result. However, if patient require urgent referral, the hospital need to inform our ADCC, so primary team can give them ADCC number, so they're going to inform us, okay, or even the primary team can inform us the urgency, and then we're going to request for RTK, okay, RTK, because RTK swab test is faster, then we're going to ask for RTK, okay, for urgent case referral. Okay, so for newborn referral from other hospital clinic, okay, we going to see whether the mother is COVID positive or not. If mother is COVID positive, we're not going to allow transfer. And then if the mother is PCR negative within 48 hours and baby admitted since birth, okay, baby PCR negative within 48 hours and never discharged home, baby discharged recently from SASMED less than 48 hours, or if urgent referral, RTK was done within 48 hours by the referring center. Sorry. So if they have one of these criteria, then we're going to treat as usual. Okay, treat as usual. Okay, we don't need to. We're going to treat as usual. Okay, and then if they don't have any of these, but require urgent transfer because neonate, as you all know, only HDA and only our hospital have an ICU. So if it's really urgent, so they're going to be admitted in the NICU isolation room, and then we're going to do the RTK in the NICU. Of course, if positive, we're going to do positive PCR, and if positive, treat as COVID. If negative, we're going to treat as usual. Okay. Okay, this is maternal admission. Okay, so for nurses from the PAC, right, should know this. Okay, so mother, if mother come in imminent delivery, the patient is already bearing. Okay, the labor is already in progress. Okay, so straight away patient should be put in the PAC disaster room if patient proceed with SVD, okay, or if require CT, if require a Caesar, so they're going to go to the COVID OT, okay, without waiting for the test. Okay, but if they are not in imminent delivery, okay, of course we're going to do RTK, and if RTK positive, admit to proper COVID ward. Okay, if negative, we're going to see whether the patient have symptom or not, have high risk or not. If high risk, they're going to be isolated. If no, we're going to treat as usual. Okay, if high risk, if the primary team thinks high risk, they're going to do PCR, of course. Okay, and then okay, this is for resuscitation for baby. I'm not going to share this. Okay. The NICU team and also the OG team can go through this later on. Okay, so for infant admission from ED, okay, so babies presented to ED and plan for admission, we're going to see whether they are discharged from SASMED from the last 48 hours or they have done RTK. So if there is, we are going to treat as usual. If no, we're going to do RTK as usual, and if positive, I admit to NICU isolation, right? If negative, we're going to look whether the mother is actually high risk or not, or mother is positive or not. Okay, so depending on the mother status, we're going to isolate or not the baby. Okay, so another update, okay, last one is that forensic update. So, okay, so this is the latest update from mortuary. Okay, so management of deceased patient. Okay, I think a lot of nurses already aware, the matron and the sisters already and the Sharia team already informed them, is that if there is a death in the ward or in this department, so of course we're going to do the usual inform death to the forensic unit, okay, and then refer the case to the forensic unit medical officer or specialist, complete the document, all these document, and then high risk patient need to use hospital linen for the first layer and insert the body opening with cotton soap with sodium hypochlorite. Okay, and then the new addition is that there should the patient should be tayammum on the body by ward staff if patient is confirmed COVID-19 positive. Okay, so while cleaning up the body, preparing the body, so the nurses can just do quickly a tayammum for the patient, and then it's done. Okay, so this is the new update. Otherwise, most others are about the same flow as before. Okay. All right. I think that's all the update for now. The importance update. Okay. So I open up for any questions. This guidelines, inshallah, will be on the website soon, and then we are also going to distribute the PDF format to the team, okay, to the department. All right. So any question? On the floor. Any question? Is there any question in the chat box? Okay, so Khairul Anam asked where we can download this guideline. Okay, inshallah, we're going to distribute this soon because the latest updated was just last week. So we're going to update, upload it in the website soon, inshallah. Right? And then when it's available, we're going to distribute to the RAD team, rapid assessment team, which involve or which have wakil all department. So and then they can also distribute this to all of you, all right, to all the department, all their department. Okay, any other questions? Everybody clear? Okay. So recently there are I think the most confusion is at recently the most confusion is at the caretaker. All right. So I'm just going to show again the caretaker and then tell you what are the confusion are. All right. Okay. So for caretaker, okay, there are a few confusion. Recently, emergency department received caretaker came to our department to do their saliva test in the fever counter. Okay, and they said it was informed by the staff ward. I'm not sure whether it's true or not, or are they just giving the info by themselves, and then which is not true. So we open the level 2 lobby, okay, screening counter nurse. They are able to do the saliva test from 8 a.m. to 5 p.m. Okay, 8 a.m. to 5 p.m. Okay. This is actually open every day, so they can do that test in the lobby level 2. If they come after office hour, basically the answer is simple. You ask them to come the next day. Okay, come the next day within this time. Okay, 8 to 5 p.m. All right. Okay, because most of this is for elective admission for adult. So usually adult, they don't really need a caretaker as much as a pediatric population. Okay, so they can come the next day or during the time we are provided the service. Okay, for pediatric patient who presented to emergency department. Okay, if they require admission, emergency department will straight away do the mother or the father, whoever want to take care of the child in our setting. Okay, because pediatric always come with the caretaker. It's impossible for them to come alone. Okay, and they need to be admitted together. All right. But for adult, the caretaker can come back tomorrow for the test if they come after office hour. Right. Okay. If there is no question, then I return the floor back to the moderator.
Assalamualaikum Dr. Syako, Dr. Hidayah here.
Waalaikumsalam.
Okay,
Yes,
so Assalamualaikum everyone. So I hope you all take this opportunity to clarify anything yang tak clear with regards to SOP. So in terms of this SOP, the authority cuma ada kepada EDCC dan CMU sahaja. Okay, for those yang not clear of any SOP, mohon refer kepada dua sumber ni lah. Alright, untuk mengelakkan sebarang pencanggahan SOP, as you all aware, SOP kita sentiasa berubah-ubah, in which we cannot avoid. Nak kata guideline yang MKN provide pun akan berubah-ubah from time to time, so we need to keep up lah, insyaAllah.
Yes, true. So any question, any queries, or you are not sure, you can go through these guidelines when it's available. Okay, if you are not sure, you can ask us. Okay, the extension number you already know. Okay, so you can ask away. All right, no issue. All right, but don't give false or don't give assumption. Okay, oh saya rasa macam ni cara dia bagi kat caretaker. So then it's going to it's involve a lot of people. Okay, so don't do that and just confirm with us. All right. Someone mentioned the caretaker can be changed or not. All right. Okay, so if you look here in the guideline, even though I didn't mention during my presentation, here there is a criteria for caretaker. Okay, only patients who are ADL dependent allowed for caretaker. Okay, so if the patient is conscious, able to walk, able to ambulate in the ward, we don't need caretaker. All right. And then we only want one dedicated caretaker only at a time. And then the caretaker should have no close contact with positive patient and they are asymptomatic. Okay, so one dedicated caretaker only. All right. So if is any reason they need to change, so you can call EDCC first, right? But so far we don't want to allow any changes, but if they need, we can only allow after 1 week. Okay, so 1 person 1 week. All right, so we also notice there are some genius caretaker. Okay, they bought a lot of RTK self-test and they go in and out through the hospital and they just repeat the RTK. We don't want to allow that. Okay, so the nurses in the ward should play a role. They shouldn't allow the caretaker to go in, go out as many as they want. Okay, so just make sure that they are only they should be one caretaker only, and they shouldn't be going out and in hospital as they like. Okay, so the screening nurse counter and also the ward nurse should try to take care of this. Okay, monitor this. Any more question? Oh, okay. Someone mentioned macam mana nak semak kawasan yang PKPD. Okay. Okay. PKPD area actually you can browse it online. Okay, it's there. It's been 2 years. You can monitor it in the online platform. Or our ADCC also provide the latest PKPD area. Okay, we give you daily updates, daily COVID-19 report. Okay, where we distribute to our red team, and I hope red team also distribute to their team members. All right. So from there you can see where is the updated PKPD area. But if you don't have that, you can just simply open up your monitor, your computer. Okay, you Google PKPD area in Malaysia, then there will be a lot of information in the online. All right. Any more questions? Okay, if no more question, I think I should stop now. And I thank you very much. Oh yeah. From my MO, you can also look at the Telegram, MKN Telegram. I think most of us already have MKN Telegram in their phones, so you can look at the updated KPD area in the Telegram group. All right. So with that, I end my session. So thank you very much for your attention. So I hope this give you a bit clearer view of our SOP. Mainly, I presented about the COVID, the patient entrance. So later on, regarding the ward, the SOP in ward, the SOP in OT, you can read through the guidelines. Okay. With that, I end my session. Thank you so much.
Thank you, Dr. Shakur, for becoming our speakers for today's program. Now, I will pass the next session to Dr. Fadi.
Ada soalan tu dekat ni, chat.
Ada soalan satu lagi.
Okay. NICU Ayah.
Ayah nak tengok anak dia.
Okay. In NICU, all right. We are going to because in NICU it's a special area where sometimes the family, the caretaker, the parents, mother or father, okay, they need to come every day. So we allow RTK once a week. Okay. But you have to make sure the caretaker who come, the father or the mother who come, is asymptomatic, no recent contact, okay, no symptoms, okay, and not from PKPD area. Every day you have to make sure. Okay. Okay, so they consider a caretaker, but they are not in the ward because just a special situation for NICU. Okay.
Okay, alright. Terima kasih. Thank you to Dr. Assistant Professor Dr. Abdul Shakur, and also thank you to Sister Nabila for our first session just now. Without further ado, I would like to invite our next speaker, Assistant Professor Dr. Nur Hidayah binti Kamarudin.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Okay, first and foremost, let me share my screen. Okay, first I would like to thank the organizer, CMU, for inviting me to the CME. Okay, so Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh to everyone. So we have quite a number of participants today, around 200 plus. So Alhamdulillah, thank you to all of you for being able to attend. And thank you to Dr. Shakur just now. He had been explaining quite extensive on the SOP, so I hope everybody is clear. And please don't hesitate if you have any issue to clarify your doubts at EDCC or at CMU, inshallah. So for my session, I've been given an allocation of half an hour to go through the topic on hand hygiene and PPE, where I required all of you to click at the link that I've posted in the chat at Zoom. And for those who are attending through YouTube, you can log on to joinmyquiz.com and enter this game code. Okay, what will happen in the next half an hour is that we'll go through few slides with regards to hand hygiene and PPE. Basically, nothing new, tak ada benda baru. And we have been through this multiple times before this, so regard this session as a revision or a reminder punya session. So I need everybody to participate. So because we have quiz afterwards, and those who perform well, inshallah, there are awards waiting, prizes waiting, inshallah. Okay, we have 73 already participants. We give 1 or 2 more minutes for everybody else to join in. Okay, while waiting, so as you all know, we are now in a endemic phase for COVID-19. Not only for COVID-19, we do need at all time to adhere to hand hygiene and correct donning and doffing and selection of PPE material, because this is our last defense basically. Tak ada apalah barrier yang menyekat kita daripada mendapat infectious disease ni, because we cannot eliminate the patient. Patient memang akan keep on datang dekat kita. So these are the things that we should practice and make it our habit lah. Especially part hand hygiene dan juga pematuhan kepada PPE lah anyway. Alright, 105, any more coming? Okay. Rugi ni tak join ni. Nanti kalau perform well dapat hadiah. Soalan tak susah, insyaAllah.
InsyaAllah Doktor, kita ada 238 participant currently in our Zoom. So
we still have 2 minutes to 9 AM because my session officially start at 9, right? So we still have time to allow everybody else to join in, insyaAllah. We have 117. Sila masuk. Because in a way, Dr. rasa we keep on giving each time we have session on infection prevention and control measures ni, we just giving it one way. Now I'm looking for more engaging session because I wanted you to know what is your knowledge basically and what is the level of compliance to these to all these IPC measures lah. Because we need to do this from time to time. All right, 135. For those who just come, please log into the website, joinmyquiz.com and enter this game code 597628. So what will happen is that afterwards, there are few slides. Basically, the slides are our revision or similar things that I've been explaining during our previous session on IPC measures. And afterwards, we are going to have a few questions or quiz session, and you have to attempt the question based on your level of knowledge and based on your level of compliance. Right? 144. Fadi, signal lah Fadi, bila boleh start Fadi? Only 3/4 je dah masuk ni. Ada lagi.
Rasanya dah boleh kot sebab already 9 o'clock.
Okay. Alright, thank you Fadi. So we start. Okay, can see the slide basically. from your website? Okay, hand
Yes.
how am I going to lose this one? Okay, it's okay. So hand hygiene and personal protective equipment, right? So basically, hand hygiene and personal protective equipment is part of the standard precautions. There are at least 5 measures that is included under standard precautions. Standard precautions are basically precautions that we should adhere to at all time for all patients, regardless of patient's infective status. Whether you know it or you don't know it, you suspect it or you are not suspecting of infection, you should adhere at all time to this standard precaution. And the 2 things that I will be highlighting during this session is hand hygiene and personal protective equipment. All right. Okay, this is slides that I've been showing you to all of you over and over again. Basically, if you look at your hand right now, you don't see any visible dirt, any macroscopic dirt you won't see. But these basically are the colonies of bacteria. If you were to culture or you imprint your hand or your thumb onto this culture plates, you can see all sorts of bacteria growing. It is either your normal flora or the contaminants that is there in your environment when you touch the surfaces, because you don't know what kind of organism it might be Staph aureus, it can be MRSA, ESBL, you won't know. All right. So in order for you to remove all of these impurities, you need to follow strictly to these moments of hand hygiene, your moments, my moments of hand hygiene. Basically, it is very much important, especially when we are working in the hospital or in any clinical setting. So there are basically 5 moments of hand hygiene that you need to adhere to. The first one, before you are touching a patient. Second one, before you do any procedure onto the patient, regardless of clean, dirty, septic or aseptic procedure, especially the aseptic procedure, you need to perform a proper hand hygiene. The third one, after you expose to patient's body fluid, this one, no choice, you need to perform a hand hygiene. And after touching a patient and after touching the patient surrounding, you will know in the environment, in the vicinity of the patients, there can be all sorts of nosocomial pathogen that you cannot see with your naked eyes. So in fighting this invisible enemy, you should perform this hand hygiene, and you should grab every opportunity that you have to perform hand hygiene. So there are 2 ways of performing hand hygiene. I think by now you all should be familiar with this: hand rub and hand wash. And in order to perform a correct technique of hand hygiene, I think at every sink in the clinical area in SASMAC, there are posters being posted dekat sink. So if you are not sure on how to perform a correct technique of hand hygiene, please refer to the poster. All right. So hand rub and hand wash. Okay, basically take less than 1 minute to perform hand hygiene, and it is worth it. All right. Don't see a proper hand washing as something that is wasting your time. That is a very incorrect mindset. And if it is happen that you wear a glove, it does not substitute you of performing hand hygiene. Right. Okay, other than hand hygiene, the second point that will be highlighted in this presentation is basically adherence to PPE. So we have all kinds of PPE, in which we have another presenter after me afterwards explaining on the protocol or procedure on getting the PPE material. So PPE, other than hand hygiene, is basically our last line of defense. So in order to defend ourselves, we need to select the PPE material correctly. And after we select the material, we should don it properly. Okay. Material yang betul tapi cara don yang salah, it won't serve its purpose. So membazir je pakai PPE tu. Alright. So the reason that you have to put on this Defense is basically you wanted to avoid from you spreading infection to the patient or getting an infection to the patient or spreading the infection that you might have to your other colleagues. So we wanted to avoid this. And a real life example that I can give is that we have seen it basically with regards to COVID in our recent outbreak. If the close contact all adhere to a proper PPE, the magnitude of the outbreak can be minimized. Okay, so if you adhere to a proper hand hygiene, proper PPE, donning and doffing, it may reduce. Okay, so your department, your wards or your clinic can resume the activity at those area maybe dengan cepat lah, tak perlulah kita extend restriction of activity dekat work tu in terms of kemasukan, in terms of discharge, in terms of pergerakan staff. Okay, kalau adhere, the time frame of us to manage the situation tu boleh di cut short rather than it has to be prolonged daripada seminggu jadi 2 minggu, 2 minggu jadi 3 minggu. So we cannot afford that because currently our hospital is running at a normal pace already. Yeah. All right. So each and every one of us is expected to wear a mask. Okay. So universal masking is still applies. So you are expected to wear a face mask, a medical or surgical face mask, or double masking at all time. Okay, double masking is basically in areas which is non-clinical, but in clinical area, a single layer medical or surgical face mask is already adequate. All right, and make sure, please wear your mask properly. We have seen it. We have been observing it. Staff wearing mask bawah hidung, okay, ataupun pakai mask tapi chin exposed. Okay, kita tak ada jumpa lagi lah yang pakai mask dekat dahi, yang pakai mask dekat elbow. Alright, so we don't want to see this. If you have your mask, wear it properly. Okay. So next slide. Okay, this is basically the type or the level of PPE that a person should wear if you happens to transport a specimen lah. Transporting specimen to lab, if you wear like this is already adequate. Surgical face mask, glove and plastic apron. And for diet team also, okay, like this. But it is good if staff involved in this type of activity also wear a proper level 1 PPE, which is include the face shield. Okay, next one, level 1 PPE. So for level 1 PPE, in SUSMED and IIUM, these are the list of level 1 PPE. The face mask, face shield, gloves and plastic apron. Okay, you are expected to wear level 1 PPE while attending patient, regardless, especially patient with no known risk of getting COVID-19 in clinical area. All right, this is the general rule, okay, that we should apply in clinical area, especially while managing patient. So next slide, we are going to look into the transmission-based precaution. So just now, we don't know what we are not sure. We are not, regardless we are suspecting or not suspecting, especially during suspecting a patient of having a certain form of infection, we should apply this transmission-based precaution. Okay, as you all know, infection can be transmitted through multiple ways. It can be through droplet, can be through direct contact, and can be through airborne. If we are suspecting that patient of having certain type of infection and we know what is the mechanism of that infection transmission, then we should apply this transmission-based precaution. So for the matter of this presentation, I will highlight on the option of PPE that is available for us to prevent this specific transmission of infection. Okay. So next is level 2 PPE. Okay, this is level 2 contact. Basically, you are expected to wear this level 2 contact level of PPE if you are attending patient, for example, harboring multi-drug resistant organism, which is known to spread through contact, such as MRSA, ESBL, CRE, and so on. All right. Other than that, those who are performing a decontamination process is also expected to wear this level of PPE. And in KKM side, it is allowable for a staff to wear like this in providing care to a person under investigation for COVID-19 who are able to wear masks themselves. Okay, this is dekat KKM lah. But for our setting in SASMED and IIUM, we are expecting you to adhere to level 2 Airborne as a extra precautionary measures lah, managing PUI or even a COVID-19 positive patient. You can wear a level 2 Airborne, which is composed of N95 mask, face shield, glove, fluid repellent full body gown. You can have your plastic apron outside of your long sleeve gown, and you should also wear boots or shoe cover. And providing care to a person under investigation or providing care to COVID-19 positive patient in the event of unavailability of level 3 PPE. So this is the alternative lah that you can resort to if you cannot get the supply of level 3 PPE, the jumpsuit one. All right. So in performing aerosol generating procedure, also you should also wear level 2 airborne PPE with N95 mask. So I think by now everybody is already aware what are the type of procedure that is considered as aerosol generating procedure, such as intubation, tracheostomy, okay, ventilation, suctioning, and so on. All right. So in the event of performing aerosol generating procedure, if you are not wearing a proper level 2 airborne PPE, then you are considered a high risk close contact and you should be swabbed twice. All right. If you are negative the first swab lah. Okay, last but not least, level 3 airborne. Okay, so the setting here is only for providing care and performing aerosol generating procedure to COVID-19 positive patient. So I would like to highlight again, if level 3 PPE is not available, then for us to don a level 2 airborne type of PPE. All right, so next we are going to have a brief video presentation. So let us all see.
Preventing COVID-19 in your workplace or while teleworking. There are several things you can do to protect yourself and others from COVID-19 in your workplace, whether you are at your work site or teleworking at home. Follow distancing measures issued for your location and stay informed through information from trusted sources, such as WHO and your local health authority. Stay at home and avoid direct contact with anyone if you feel unwell or even have a mild cough. This will help protect your colleagues at work and your family members at home. If you're feeling well and need to go to work, you can reduce your risk of catching the virus by avoiding crowded public transport. If possible, go by bike or walk. Otherwise, if possible, discuss with your supervisor if you can work from home.
Okay, part ni penting If you're not
At
healthy,
work
please
or
don't
at
come to
home,
work.
if you can, use the stairs instead of elevators. Avoid using your hands to touch common objects like elevator buttons, door handles, or staircase railings. If you work in an office, create distance-based meetings either through video conferencing or by maintaining at least 1 meter space between people in the same room. If you work in contact with the public, stay at least 1 meter away from others as much as you can. After commuting to and from work and throughout the day, clean your hands frequently and thoroughly.
Okay,
Avoid touching your eyes, mouth, and nose.
Yep. This is very
Ventilate your
important also.
workplace regularly, keeping the windows open if possible. Make sure tables, door handles, and other frequently touched surfaces are disinfected regularly. Avoid crowded places and unnecessary public activities. Find no contact ways to greet your colleagues and express affection to your friends and family. While maintaining physical distance, stay social. Contact your family and colleagues regularly to check how they are coping. Remember to seek ways to stay active and positive. Stay healthy, and let's all prevent the spread of COVID-19.
All right. Now we arrive to our quiz session, hand hygiene and PPE knowledge and compliance quiz. Okay, everybody is ready? So answer the question based on whatever knowledge that you have, and please be honest. All right. So Bismillahirrahmanirrahim. There are basically 13 questions, and the format of the question, there are two types of question. The question that you can give a multiple answer, or the question that you can give only one single answer. Okay, I will guide you. I will guide you all through, inshallah. So we start with the first question. All right, standard precaution. What does it deal with? Okay, it's used when treating patients diagnosed with infection. Only include hand hygiene and PPE. Is used when treating all patients at all time. Adequate to prevent transmission by respiratory virus. This is one answer only. Another 30 seconds. Doktor dah kasih jawapan yang ni tadi masa awal presentation tu. So either fokus or not je lah. Alright. 5 more seconds. 4, 3, 2, 1. Time's up. Alright. So for first question, rubab replay. Okay. DD. Okay, DD is leading. Right, next question. Alright. The following is or are your moment of hand hygiene. You can answer multiple questions. You can give multiple answer. You should not participate in here. Okay, which one? That is your moment of hand hygiene. Basically, an applied knowledge, basically. You know the theory, and when you have to apply. Okay, another 10 seconds. Ramai lagi tak jawab ni. Faster, faster. 5, 4, 3, 2, 1. Okay, time's up. Okay, tak ramai boleh jawab ni. Alright. Basically, jawapan untuk yang tadi adalah kesemua lah. Alright. All four. Before perform physical examination to patient, of course kena perform hand hygiene. Sebelum wound dressing, of course, it is a procedure. And after touching patient bed rails, patient surrounding, kena perform hand hygiene. And after perform physical examination to patient, of course, memang kena hand hygiene jugalah. Okay. Next one. Okay. Okay, do you comply? Do you comply to hand hygiene practice? This one I need you to be honest. One answer only. Ya, sesi muhasabah. Okay, 20 seconds left. Compliance ke tak? So we see times are Okay, so the leaderboard. Okay, Didi is still leading. So, okay, ramai yang jawab strongly agree. Alhamdulillah. Okay, a little bit strongly. Ada yang strongly disagree ya? And ada juga yang disagree. Okay, but majority strongly agree. So we wanted to maintain a high level of compliance to hand hygiene, especially in our clinical setting. Next question. Soalan. Do you adhere to correct technique of hand hygiene? Perform hand hygiene tapi cara tu, method tu, is it correct? If it is not performed correctly, it won't also serve its purpose. Macam PPE lah. Pilih PPE yang betul dah tapi cara pakai yang salah. So it won't serve its purpose. Sia-sia je kita spend masa untuk perform hand hygiene. Ataupun sia-sia je pakai PPE tu. Okay, 20 second more. Okay, dah, time's up. Ramai tak jawab ni. Okay, Didi, Azrin Roslan mengejar dengan rapat. So alhamdulillah mostly perform correct technique. Okay, alhamdulillah. Tapi ada juga mostly no, bagus. Doktor suka ni jujur. Tapi seorang je lah. So inilah hopefully boleh familiarize dengan cara basuh tangan yang betul regardless dekat mana-mana area pun, especially clinical lah. Yang non-clinical pun sama jugalah dia punya emphasize tu. Alright, next question. So are you aware by not doing or applying incorrect technique of hand hygiene, you are at risk of becoming agent to spread infection to patient or your other colleague? Ini pun one answer. Aware ke tak? Doktor akan surprise kalau ada yang tak aware lah. Okay, time's up. Okay, kita laju-laju sikit sebab we have another 7 minutes. Next slide. Okay, next question. Okay, the following is the material for level 1 PPE in SASMEC. This one you can give multiple answer. Okay. Teruskan menjawab, 20 saat lagi. Okay. Alright, time's up. So, ada 3 material adalah PPE level 1 dekat soalan ni. So, yang bukan adalah full body gown. Azrin Roslan telah take over the lead. Okay, next one ada juga jawab full body gown adalah level 1 So, bukan Okay, next question. This one berkait dengan soalan tadi lah. Aware tak face shield tu adalah komponen level 1 PPE di SASMAC? Kita dah ada ramai partisipan ni tapi not all responding. Ini. Tiga, dua, satu. Alright. So, face shield adalah level 1 PPE. Hopefully everybody aware. Next question. Kenapa keluar ni? Salah. Okay, sekejap. Okay, this one. Okay. Do you comply to level 1 PPE during routine management of patient in ward or clinic? One answer. Okay. Time's up. Okay, so yang ni kita tengok nanti. Ramai tak dia ni? Inas Izni dah take over the leaderboard. So Alhamdulillah, strongly agree semua. Ada juga yang strongly disagree. Okay. Next question. What is the first thing you do after completely doff your PPE? One answer. Maju. Kita ada 3 soalan lagi. Correct sequence and technique ni betul kena give focus supaya PPE prosedur tu sendiri tidak menjadi situasi yang boleh menyebabkan kita mendapat infection. Salah cara doff, salah teknik boleh expose kepada infectious pathogen ni. Okay. Time's up. Alright. Oh, okay. Siapa rentas negeri ni? Okay, semua strongly agree. Alhamdulillah. Ada juga yang ni. Agree. Okay, next. The first thing you do after completely doff your PPE. Pergi minum. Ke tukar scrub. So kena buat apa? Okay, so jawapan dia kena perform hand hygiene after doff PPE. Okay, next question. Ini second last question Mana soalan ni? Doktor tak nampak letterbox. Are you confident that your compliance to IPC measures are being monitored while working in SASMAC? One answer. The second last question. Alright. Nak pergi laju-laju ni. Second last question, right? Oh, this is the last question. This is the last question. So what is the correct way way of us wearing a face shield? One answer. Oh, yang ni ramai ni yang pakai macam pakai topi. Kita tak ada nampak lagi lah yang pakai face shield tapi tak pakai mask. Okay, 20 more seconds. Alright. So we have arrived at the last question.
Masuk air sekejap.
Di mana tu? Okay, so last but not least, kita end the session. Yes. So kita tengok who is leading. Alright, so Inas Izni. First, second place Rentas Negeri, and third one is Wani. For the first, second and third place, you are required to go to Infection Control Unit tomorrow at 11 PM to claim your prize. Thank you very much. That's all from me. Ada soalan? Kita dah take 3 minutes from Ted punya presentation. Okay, so over to Fadil.
Alright, terima kasih. Thank you to Assistant Professor Dr. Hidayah for fun session just now. Santai dan semua orang seems enjoy. So reminder untuk pemenang tu make sure pergi ke kita punya Infection Prevention Control pukul 11 pagi esok. And next to our brother Zulfikri untuk our PPE indenting protocol.
Okay, thank you so much Dr. Fadi and Dr. Hidayah for very sampai punya presentations. So taking the baton from Dr. Hidayah, I will proceed with the process of indenting of PPE and supplies of PPE, specifically of PPE. So kejap I share my slides. Okay, so I hope everyone can see it clearly. So thank you so much to CMU. Actually, I just came back a week ago, so I was being tasked to give on CMU, particularly PPE and supplies lah. So let's the scope of presentation today will focus on the procurement process, some overview, as well as the process of PPE supplies in them. I'm specifically using air kewangan lah, so I will actually show air kewangan simulation, certain things, certain aspects that the end user, particularly in from the clinical departments, to do lah to smoothen the process between the store as well as the sub-store. So some overview of the procurement itself. This is what the medical store unit has been doing from the process of requesting the items. This is general, like it applies to everything that we are buying, including drugs, specialized and general consumable. We start off with the requesting the item itself, which normally take around within 2 days. Then we move on to quotations. We request from the suppliers. Depends on the urgency of the item itself. It can go up to 3 to 7 days. Sometimes if we call the item itself, it requires more than that, beyond that, because we are dealing with external party kan, macam suppliers ni sometimes they don't respond to us within the stipulated durations, so they may require some extra 14 days lah or more. PO, then once the quotations are being completed with the necessary forms, complying to the policy, then we proceed to release of PO from Kewangan. This is mainly from the finance department. From our experience, it took around 5 to 7 days. Then we proceed to the important parts from the suppliers, delivery and receipt. This is the critical part where in the PO itself, we put 2 to 4 weeks, but somehow due to inavailability of the stock at the supplier end, it could go beyond months lah. Okay, this is where we have to make a decisions whether to wait for the items to come, or we have to make another urgent purchase to cover for the gap period. Then storage, of course, when the items being delivered to us, we have to store it upon GN approval in Kewangan. And the last part is the your side, the end user or sub-store, getting the item through Kewangan by indenting your requested items. Okay, so in store, I think many of you are not aware, because this is mainly the things that we'll be doing lah. Among the general consumable and also PPE is part of it. These are the type of procurements that we have been dealing lah. So mainly on contract. Now we have our own contracts of PPEs, which previously was actually from FPPL. If FPPL is actually from Pharmanega. So some of you may know that Pharmanega is supplying not major, 30 to 40% items in KKM hospitals. So we do have the eligibility to buy from FPPL as well, but due to recent pandemic, there are some of the items in FPPL, mainly not all, most of the PPEs, macam gloves, macam hand wrap, surgical face mask. If you realize between these months or a year, they have been changing of the items kan. Previously macam consistently a year tu macam sama je, lepas tu within this pandemic ni you'll be changing brands, are we changing spec lah, because FPPL itself they do not have the stock at their warehouse. We are competing across the nation, right? KKM is like macam getting more and more, so we are being pushed down the list. That's where we resulted to get our own contract of PPEs. Okay, if these two are down, we have to resort to direct purchase untuk cover the gap lah, if the suppliers and the FPPL for Merdeka specifically cannot commit to the items. Okay. So then we move to the PPE supplies and indent. Don't worry about the slides, they mainly are pictures lah. Okay, generally we have our schedule. For the schedule punya indent, some of the wards are twice a month, meaning that bi-weekly lah. And most of the clinics and other clinical units, they are scheduled for monthly basis punya indenting. So what we are expecting from the end user actually to indent according to your PAR level, min max lah, basically some people call it. Min max ni kalau macam those yang wards, I believe, I understand that your storage are not that big. Sometimes you indent banyak-banyak, tak tahu nak letak kat mana, then it goes beyond the storage itself lah. So which is not good lah. Kalau audit datang memang maybe they can query. So the rule of thumbs is that kalau untuk most ward atau ED ni yang macam every 2 weeks ni, you can keep the stock like 3 weeks to 1.5 month. That is your movement, but it depends on your usage. Some in certain situations in macam endemic ni, memang you akan nampak the surge of movement. So that is where you have to review back your min and max and PAR level lah. And also not to forget the fast moving item memang macam tu. Kalau slow moving, we tend to overlook. This is where you have to really make sure that the slow moving items are not being overlooked lah. Okay, so the way of to monitor of items are using sort card. I believe you guys all have that. Kalau you perasan ada dua jenis stock card lah, merah dan hijau. Merah itu kita untuk item-item yang ada expired. I think 95% of our items, especially general consumable drugs, semua ada expiry lah. And to be alert with the expiry, okay, to be alert with the expiry, it's not like macam sehari dua before the expiry, it should be months before. Best practice is 3 months or 6 months. Meaning that you have to monitor, meaning kalau dah jadi 6 bulan, what you want to do with the items? You want to make it bergerak laju within the unit, or you want to offer to other units as ward ke klinik ke yang willing to take the item, yang fast moving for the items, or maybe through us, maybe nak offer kepada hospital luar lah. Tapi yang tu is not a concern, that's our concern lah. So you mainly internally lah. So I will explain more about the macam mana you nak offer endo nanti dalam sistem kewangan lah. And of course recall product, yang ni akan dapat alert atau instruction daripada medical store untuk collect the item. Macam mana you nak tahu recall product ni? Recall product is not based on item tau, it based on the batch number of the item. Contoh, kalau you ada gloves, contoh kalau you perasan dekat dengan ada setempat dekat kotak tu ada batch number ataupun expiry kat situ, dia ada batch number tu, dia akan recall product based on batch number. So kalau you ada brand yang sama glove, mungkin ada 3 batch number yang berbeza. So the best practice is to susun your punya barang-barang dekat dalam storage shoe berdasarkan expiry is the first, yang depan lah, first expired first out. At the same time, you pun kena nak mudah you group them into the same batch number. And in certain situation, different batch numbers would have the same expiry dates. Okay, so those that in charge for the store has to be really alert of this thing lah. That's why dekat dalam stock you, stock card you tu, you jangan you tak boleh just tulis item as well as the quantity saja. You kena letak batch number dengan expiry sekali. Memang jarang recall product tapi ada. Recall product usually from the manufacturer, maybe ada defects from that particular batch atau ada safety issues from that particular batch. So our side, kita akan ambil from medical store, kita akan ambil apa yang stok yang kita ada, as well as kita akan instruct and alert all the respective units to return to us lah, for us to do the massive punya return back to the suppliers. Okay. So these are the nomenclature. Kalau you perasan dekat our punya general consumable tu, these are the coding. So kita buat coding ni bukan saja-saja, dia ada nomenclature dia dan dia digit represent apa semua benda. So far kita ada 7 big categories. So for PPE, kalau you perasan kat depan 3 tu adalah GCS 02. GCS is general consumable, 02 is PPE. Kalau you nampak kat sini, dia adalah dia punya descriptions of each of the set of nomenclature lah. Dia ada general consumable, sama dia ada PPE ke, dressing ke, apa benda ke, dan subcategories dia ni sama ada dia adalah kalau macam gloves tu, you falls under PPE kan. Gloves apa? Is it sterile, non-sterile, powdered, non-powdered? So ada size and measurement is small, medium, etc. And material itself, is it latex ataupun dia maybe kalau kita ada silicone or whatever not. And DD brands. Brand is subject. Some of the items kita tak ada brand because they are over like the past. Sometimes dia tak ada brand, memang tak ada brand lah. Dan dia ataupun brand dia always changing, then we cannot afford to change the brand, so we resort to yang tak ada brand lah. But anyhow, dia tak akan touch on the operations. Okay. So next, these are the pictures lah. I think all of you knows this is our current stock of glove, and these are the coding. Yang ni Septisol. Kalau you perasan Septisol ni, our punya hand drop ni, dia punya coding ni adalah D. Tak sama macam X-Men tadi GCS kan, sebab coding ini ditetapkan under drugs punya coding. D is sebab drug ada set for coding dia berbeza, general consumable ada set of coding berbeza, and specialized consumable pun ada set of coding yang berbeza. So that stock ID or coding itu actually specific to that particular item. Even though they are falling under the same category, macam hand wrap kan dia macam ada banyak brand kan. So each of the brand or each of the size of each of the content has their own specific set of ID. Okay. So when you ordering a system, memang you kena specific to the ID lah. Okay. Next is apron lah. Okay, tak ada isu. Yang ni pun dia goggle. Okay, untuk goggle ni memang kita supply from infectious control. Tetapi dalam certain situations, macam contoh ED, ada last time I remember, they wanted to indent face shield in a large amount, meaning that even infectious control pun tak boleh nak supply to that amount, tak nak kata lah. So in that situations, maybe boleh deal terus dengan store supaya kita boleh direct supply to those respective area lah. But anyhow, status quo memang infection control. Kalau you dah setakat nak indent 10 semua benda tu through infection control lah. Okay. So the book cover as well through infection control. This is N95 through medical store. Currently, we are trying our best untuk belikan yang medical grade, because medical grade ni ada satu je extra daripada normal. Yang industrial grade adalah dia ada splash resistant, dia ada fluid resistance. So which is our AGP semua benda tu kan sometimes involve that. So best we try to get this one lah. Okay. Sometimes I believe last time kita ada issue dengan KN95 dan 95. Benda-benda macam kalau kita bertukar spek macam N95 KN95 tu biasa kita akan keluarkan memo dan biasa kita dah dapatkan approval daripada pihak supplier, yet the KN95 is sufficient for to protect as good as KN95 lah. Yang tu biasanya kalau benda-benda macam tu bertukar-tukar stok tu memang dalam keadaan yang macam I believe masa during pandemic is always ever changing, because nak dapatkan stok tu normally all the suppliers are getting their stock from India, from the China, from other countries. Sometimes they do have some embargo ke apa benda ke, dia pun ban untuk export the items because they want to take care of their hospitals as well, right? So they ban certain items to be exported to other countries. So that affects us nationwide lah. This is face shields from infection control, and tudung protective cap is the hood. Yang ni pun not only for PPE untuk yang COVID saja, dia pun involve dalam untuk patient juga pakai jugalah. Okay, disposable face mask is normally memang kita akan simpan standard adalah tie on, tapi ada juga yang kita dapat donations yang sebelumnya ada yang ear loop. Okay, so kalau donations tu kita ada indent secara manual. So a shoe cover, the standard item from store. This is our current punya PPE jumpsuit. Ada 4 different sizes. Supply for infections control. Last time we used to have a separate hood and as well the whole jumpsuit. Now we buying the whole set from the hood to toe. Memang satu complete one piece lah. Okay. This is installation ground 40 gram at least, because kita nak make sure that it's resistant to fluid and other punya particles lah. Okay, now we move on to air kewangan simulations. I can show you simulations macam mana nak proses yang penting lah yang I expect you guys to, those yang team leader ataupun liaison officer from the each respective unit should be well versed with. Okay. Okay, the main concern yang I nak fokus adalah these 3. Stock request, getting the item itself based on the schedule that you are being put on. Dan juga stock adjustment and stock receipt. These 3 are 3 important components yang I expect daripada end user to be aware of and know how to troubleshoot. Okay. So let me switch the window sekejap. Okay, if you look at my punya screen right now, I'm showing. Sorry. Change it. Okay. So if you look at my screen right now, I'm showing the air kewangan punya interface medical store. Okay, my access memang ada banyak lah sebenarnya. So before you choosing your punya store, you make sure that it's actually your store. Certain clinical unit, dia ada 2 store. Kalau you pasang kat sini medical ward store. So I believe hari tu ada isu dengan technical lah, isu the system connect character. So we are resorting to the giving this kind of solutions. Tapi untuk yang general consumable, we are using the yang ada pattern store kat belakang tu lah. Okay. Okay, first thing first about indenting, you kena tahu adalah stock request. Okay, so I tunjuk contoh satu. I pergi kepada let's go to general medical ward IN1. Okay, medical store. Okay, dekat mana you nak tengok you punya nak open request, saya rasa yang ni semua tahulah. Dekat open request ni memang akan you boleh indent. Okay, before you nak open request, saya nak tunjuk dekat stock inventory. Okay, dekat stock inventory ni, sorry, apology because it's a bit lag. Okay. So dekat stock inventory ni, you akan dapat semua list of the set of items yang telah di-attach dan activated daripada medical store kepada respective unit in the situation in general medical ward 1. Okay. So these are the items and the current quantity ini adalah the current quantity yang sepatutnya tally dengan physical stock you. Maksudnya di sini, setiap kali you keluar stok digunakan untuk patients ataupun untuk kegunaan ward, stok itu tidak sepatutnya terkumpul, dia sepatutnya keluar. Okey, berbezanya ubat dan juga general consumable ni di mana dalam ubat daripada air kewangan dia boleh link dengan air pesakit ni, meaning that kalau doktor prescribe dan you dah administered benda tu, dia akan automatic tolak. Tetapi untuk general consumable that doesn't work in such way. So when you are getting your items daripada medical store, you terima dekat you punya store, contoh general medical 1 ni, kalau you tahu buat stock adjustment accordingly, tentatively and on the schedule basis, your stock akan berlonggok-longgok kat sini. Ada situation tu I buat stock, so my boss buat spot check random tu, ada satu clinical unit dia punya N95 beribu-ribu. Lagi banyak daripada stok dekat medical store. So that's why I emphasize tadi, you kena buat stock adjustment. Nanti I show macam mana buat stock adjustment. So this is how you look at the items yang ada dalam store you. Ada situation di mana item tu yang nampak ward lain ada ataupun klinik lain ada tapi boleh check kat kewangan tak ada. You kena notify store, specifically team general consumable, which is under Encik Syahid. You kena make sure that dia attach dan activate dekat tempat you, baru dia akan appear kat sini. If not, it won't appear. Okay. So this is stock inventory apa yang ada dekat dalam store you lah. So macam mana nak buat indent? Macam biasalah, you open dekat open request ni. Semua dah lagi power daripada I. So you kena send request kepada medical store. Okay, you pergi dekat medical store. Yang ni standard lah. Tetapi sebenarnya I tak tahu ada orang guna ke tidak lah features ni. You boleh minta daripada unit-unit lain juga. Contoh medical 1, contoh yang nak pakai urgent malam kan, you tak boleh indent daripada inpatient, tak boleh indent daripada medical store. Dan you tahu benda tu ada dekat you punya jiran sebelah dekat general medical 2. So you boleh request kat general medical 2. Okay, saya tak galakkan, saya galakkan penggunaan air kewangan ni supaya boleh nampak setiap pergerakan item tu berapa banyak dan brand mana bergerak daripada mana ke mana. Senang you nak track. Sebab kalau audit ke apa benda ke, senang you ada transaction situ. Bukan setakat bergantung kepada bukan setakat bergantung kepada stock card saja. Okay.
Tak dapat clear lagi.
So now kita move kepada stock adjustment. Okay. Stock adjustment yang ni sebelum you buat indent, sebab kami dekat store sebelum kami screen dapat list apa benda, kami akan tengok dekat you punya current stock semasa item apa you indent. Kalau you ada item tu banyak, maksudnya you tak buat adjustment, dan kami ragu-ragu dan nak supply, dan benda tu akan delay you punya supply dan approve of supply lah. So contoh it's like benda paling simple adalah tax lah. So you boleh dan you boleh buat adjustment in and out. Okay. So yang ni kejap January America 1 ni I kacau sikit your store tapi I takkan buat apa-apa. So you boleh in and out. Maksudnya in situation you kalau you pakai you out lah. You out berapa banyak. Saya suggest you punya adjustment ni jangan longgokkan. Kalau klinik sebulan you buat sehari sebelum, memang payah. Okay. Saya sarankan those yang in charge you buat weekly basis lah. Ataupun kalau you rajin maybe 2 kali seminggu. Okay. You have to make sure that apa yang you pilih tu betul lah stock ID yang ni. Okay. So that is stock adjustment. Dan you boleh remark kat sini. You remark maksudnya dikeluarkan, kalau you rajin boleh tak dikeluarkan kepada bilik 1, bilik 2, bilik 3 ke apa benda ke. That is one of the things how to remark. You janganlah tak letak remark, best is that you tak remark sebab sistem bila buat adjustment you tak akan capture expiry dan batch number. Best is that you letaklah kat situ batch number apa yang guna, expiry mana yang telah digunakan. Okay, that is stock adjustment. Before you buat request, you buat adjustment. Okay, bukan buat adjustment lepas request. Maksudnya buat adjustment tu penggunaan keluar. Okay, kenapa kena buat adjustment? Because sistem dia tak auto tolak daripada sistem. Dia tak boleh capture you keluar kepada siapa. Kalau ubat senang because dia keluar dari segi prescription. So dia tag kepada patient. That is why you kena buat adjustment. Okay, now is you receive stock kan. Okay, skala request receive ni yang ni kalau contohnya daripada store kami approve dan kami dah prepare, you kena buat receiving dekat you punya store, bukannya setakat you indent lepas tu assuming store dah approve benda tu automatic dalam masa sistem you. Tidak, you kena approve kat sini, you kena accept sebab sometimes quantity dia tak sama kat sini. Okay, lagi satu I nak emphasize, I lupa yang bila you request item ya. Okay, I have another 5 minutes. Bila you request item, jangan tukar yang ni 200 pieces per box, 1 piece per box, 1 piece ni jangan tukar because this adalah default SKU ataupun UOM, unit of measure untuk item itu. Okay, saya tak naklah nanti you rajin pergi tukar 200 pieces, you tukar, you nak 1000, very odd number, contohnya 166. Sebab daripada medical store kami tak supply loose. Tak supply loose maksudnya kami tak supply by keping-keping, kami supply by kotak. Contoh aqua swab dia satu kotak memang 200, kami supply by box of 200. That is the reason why even you nak tak 200 pun you dah assume dia sebagai pieces. Kami tak galakkan sebab benda tu dia akan kacau semua quantity tau, semua quantity dekat especially dekat store. Okay, so jangan tukar yang default kat sini SKU. You just make the congak je dalam kepala lah, maksudnya dalam 200 pieces maksudnya order satu lah kalau you nak 1 box. Okay, kalau you nak 5, say you buat 5 je lah, you tak perlu buat kalau 500, 1000. Tak, nanti dia akan kacau. Dia akan kacau kat sini. So jangan ubah, saya galakkan sebab bila yang you ubah, you akan kacau sistem kami akan ambil masa untuk approvekan ataupun worst come to worst kami akan minta you indent balik. Okay, so that is, I think I covers most of the important things lah untuk yang indent. So 3 perkara tadi. Okay, macam mana nak tahu tadi yang macam UOM tu maksudnya unit of measures tu, maksudnya kiraan dia tu, you boleh tengok dekat sini. Okay, contoh dekat ya, satu 3 minit ke?
Lagi 5 minit.
Okay. Sebab tu. So macam ni kan you boleh tengok dekat sini. So SKU pack size ni maksudnya kiraan dia dalam 200. Even though you nak pakai loose, you memang kena indent by 200. Ataupun kalau you nak memang loose like memang tak habis, maybe you have to share with other clinical units lah. Maybe clinics ke tak pakai banyak ke lah. Okay. I think I covers everything. So my last slide would be okay, so jumping to conclusion. Okay, so I'm expecting all the boleh nampak sorry. Okay, so I'm expecting all the stock request daripada end user. Sebelum buat stock request, you kena buat frequent stock adjustment, jangan long buat setiap bulan, dan you kena receive daripada stock. Stock request tak semestinya daripada store saja, you boleh loan daripada unit-unit lain lah atas dasar persetujuan mereka. Dan in conclusion, I aware there are some improvement yang store boleh buat lagi. So especially in terms of supplies of item timely dan juga communication relay. Maksudnya di sini kalau item tu ada isu stok ke apa, kami akan try kalau boleh kita memokan supaya dimaklumkan kepada semua respective unit. Dan as anticipation daripada substore, harapan daripada medical store adalah tolong buat stock adjustment dan juga tolong indent as per par level. Maksudnya per par level ni kami akan tengok daripada site kita orang transaction 2-3 bulan sebelum ni. Dan sadia ada search, kami akan query lah. So di mana situ kalau you perlu revise, you revise dan inform kami. Dan indent as per correct pack size yang I inform tadi UIM. Jangan ubah dia punya default unit pieces sebelum itu as follow it. Follow whatever it is. I think that will be all. Kalau ada Q&A lah. Otherwise, thank you.
Assalamualaikum warahmatullahi wabarakatuh. Thank you Brother Ted, Dr. Hidayah ni. Okay, basically Doktor nak highlight kepada participant jugalah in terms of the distribution of PPE ni, function of infection control hanya untuk distribute, dan availability of the PPE material tu memang depend kepada availability of PPE tu yang medical store ada lah. So hopefully mohon kerjasama jugalah untuk tidak push infection control untuk make it available, in which kita macam our hands pun tight lah, depending on apa yang farmasi supply untuk kita. Okay, sekian untuk makluman, terima kasih.
So nak emphasize lagi, kalau you nak minta stok banyak apa yang quantity in hand daripada infection control, do direct to store lah. Sebab kami ada, hopefully ada more stocks lah, bigger stock than infection control has.
Okay, is there any other last question from the participants? Ada siapa-siapa lain yang nak tanya soalan kepada kita punya speakers hari ni? Saya tengok kat checkbox dah tak ada soalan. Jadinya, semua boleh isi feedback form. So I thank you to all our speakers today, Dr. Shako, Dr. Hidayah and Brother Zulkifli, Ted, for presenting to us and informing us about regarding the PPE protocols and everything. So I think we can end our CME today with Tasbih, Kafarah and Surah Al-Ikhlas.
Alright, thank you everyone. Assalamualaikum.